Hi everyone, I'm Jim Ryan and I hope you're having a nice evening. I'd like to welcome you to what we are going to be calling UVA Weekly, a Thursday night program that will feature updates not just from me, but also from UVA students and from our medical professionals. Our aim with this program is to bring you up to date on how things are going and to highlight the most important news of the week related to COVID-19. It's meant to complement the Thursday newsletter and the admittedly sometimes long and dense emails you've received. In this week's segment, you'll hear about the importance of getting tested through UVA Health and cooperating with contact tracing, neither of which will get you in trouble and both of which are really important so that we can stay one step ahead of the virus and slow its spread. You'll also hear about the randomized testing that's going to begin later this week as well. This show is coming a few days after we began in-person classes, and I hope everyone is well and adjusting to a new way of learning and living. I had the opportunity to help move in some students over the weekend, a weekend of great excitement, but also anxiety for sure, for all of us. This is going to be a very different kind of semester, and one that will require all of us to work together to keep each other safe and well. I've been really impressed by and grateful for the efforts I've seen so far on the part of students, faculty, and staff to follow health and safety protocols. I know the various rules can seem complicated at times, but the basics are really simple. Stay 6 feet apart and wear a mask when inside. Wear a mask outside when you can't be at least 6 feet apart. Wash your hands frequently. Don't have gatherings that include more than 15 people. And if you have symptoms, please self-quarantine until you can get tested, and please get tested right away. Last, if you're living on grounds, I would suggest you avoid gatherings off grounds for a couple of weeks. Let's ease into this semester and do our best to keep this virus at bay. That's all from me tonight. If you have questions or suggestions for the show, please reach out to my office or to Matt Weber at mw2xy@virginia.edu. This is an experiment and one that we will continue to work on to make sure we're getting you the information you need while at the same time showcasing some of the talents within this remarkable community. Our hope is that this show will help bring and keep the community together during an exceptionally challenging time. Thanks, and enjoy the show.
Every single day, we don't know what's going to come next. We don't know how this is going to end, when this is going to end.
We will get through this, and we will get back to a time when life is a little bit easier.
There's not one big thing we can all do. It's a lot of little things that are going to add up.
Hope is the one thing that keeps us going when we can't see what's on the other side. We have the opportunity to give the country some hope.
Hello, my name is Zeno, and I'm representing the UVA team, which is a peer-led public health initiative, and we hope to do things like help to educate students on COVID procedures and stats, grow a community of care and support, and finally decipher some of those encyclopedic email messages we keep getting from the administration. In COVID news, as of Tuesday, there are 190 student cases and 231 in the university community as a whole. This is a number reported through the student and UVA Health, and it is high. UVA has started a couple of asymptomatic testing programs, including prevalence testing. This is randomized, and if you're selected, you'll get a letter and a testing appointment with details on the location. The test shouldn't take more than 10 minutes, and it's just like the Let's Get Checked test we're all very familiar with. Testing and contact tracing are the best ways for us to keep each other and the community safe, so please show up for your appointment if you get selected. Also, if you have symptoms of COVID-19, call Student Health. You won't get into trouble at all if you have a positive test or for any information that you reveal for contact tracing purposes. And their tests have quick turnaround times. Move-in was this weekend, and over 4,000 students came to grounds with parents and family in tow to move into dorms. Faculty and staff are working hard to make this process a success, including workers in dining and facilities who are struggling to support themselves, their families, their own safety and health, while working to keep us safe and healthy too. The dining hall lines and crowding in Oak Hill increases health risks for us and many of those workers. To combat this, think about going to other dining locations like Runk or Newcomb and maybe go early or later to avoid peak times. Wouldn't it be dope if UVA had an app that could let you sign up for a plate to pick up? I have no idea if this exists within dining halls currently, but computer science majors, this could be a come up, so y'all should jump on it. Also, RAs have released demands anonymously calling for systemic support during the pandemic to keep themselves, workers, and residents safe. As a former RA, I know they need it. Students are continuing to ask for change that needs to happen, and that's incredibly important. I hope that the hardworking individuals in HRL can provide while receiving resource from the UVA administration. This is the first and what we hope will be a weekly segment, and the UVA teams wants to hear from you. What is confusing you, annoying you? What do you want to know more about in terms of UVA and the virus? What issues you'd like us to promote and bring up to others? Email us with your thoughts at uva@virginia.edu. And we'll try to address your questions through your posts and future videos. You can follow the campaign on Instagram at uva.safe. Why my friends on the team chose me to do this every week is beyond me. But I hope you'll stay tuned to watch me either become an overnight success or a total train wreck. Either way, this could be fun. I mean, like, what are you watching, NBA playoffs or something?
Testing at UVA for COVID-19 is constantly evolving as we integrate new knowledge and experiences from other institutions. Currently, testing for COVID-19 has several different pathways at UVA. One is obvious for symptomatic people who have symptoms consistent with COVID-19. We have testing available at student health and through employee health. But we've also supplemented that with several other testing strategies. For example, we have the ability to test asymptomatic significant contacts of people who have been maybe exposed to COVID-19. Also, a team led by Dr. Amy Mathers is looking at the dormitories and sampling the wastewater that comes from those buildings. And if those buildings turn positive for COVID-19, then we will go into the dormitories and test all the students residing there to try to detect infections at the earliest stages. What's new and evolving at UVA is that we're now embarking on large-scale prevalence testing. We'll be randomly selecting students beginning later this week and testing them for COVID-19 with the intent that we hope to find asymptomatic infections at the earliest stages. That allows us to isolate and quarantine significant contacts to try to contain the viral spread as much as possible. We hope in the coming months that we'll expand that testing to a larger group of students as we develop further capabilities. So stay tuned as this continues to evolve, but we think that our testing plan really allows us to, again, isolate people who may be infected, remove them from the general population where the virus can spread, and also detecting patients and students who may have come into contact with COVID-19 so we can quarantine those as well.
It sounds funny, but I just can't stand the pain. Girl, I'm leaving you tomorrow. Seems to me, girl, you know I've done all I can. You see, I begged, stole, and I borrowed. Yeah. That's why I'm easy. Easy like Sunday morning. That's why I'm easy.